So now I have a small talk about the anesthesia for cleft lip and palate surgery. First of all, the cleft lip is a refer to the fissure in the upper lip that may be incomplete or complete up to the nasal cavity and can be unilateral, and it can also be bilateral. The cleft palate describe a gap in the soft tissue that may be submucous in its mildest form, incomplete or complete, and can also be unilateral or bilateral. The incidence of it is globally 3.4 to 22.9 per 10,000 birth. The cleft palate is 1.4 to 25.3 of 10,000 birth. It can be diagnosed through ultrasound because the lip and primary palate formation complete by the 6 weeks. Secondary palate formation complete by the 10 weeks. So by the 14 week of pregnancy, it can be diagnosed since a very early stage. In 61% of the cases, it is an isolated anomaly, non-syndromic. Some environmental factors can be contributing, example, maternal age, tobacco smoking, alcohol consumption, drug uses, folate deficiency, and teratogenic exposure. In 30% of the cases, left lip with and without palate have additional abnormalities. In 20%, they tend to have other head and neck deformities. 15% have cardiac defects, and within the 20% have musculoskeletal and renal issues. It is common with different syndrome. It's common Pierce-Robin syndrome, Treacher-Collins syndrome, and the Dyke-George syndrome, among other. The timing of surgery, usually the cleft lip repair within the 6 weeks to 6 months of age. The cleft palate is within 6 months up to 12 months of age. So putting into consideration that those kids or those children are at risk of being, if he present with a cleft lip, we need to screen that he does not have any other abnormality. So you need to ensure that he doesn't have a congenital heart disease, which is common in 15% of their cases. You need to ensure that because of the cleft lip, they tend to have problem with aspiration. So you need to be clear that they do not have an upper respiratory tract infection. You need to be sure that they do not have obstructive sleep apnea, non-renal and neuromuscular disorder. And you need to assess their nutritional status. Make sure that you assess the airway in those kids. The airway assessment is mandatory in their features. They may have history of repetitive or very frequent upper airway infections. They can have chronic obstructive apneas because of that. Suspect difficulty in laryngoscopy associated with very small babies, bilateral cleft lips, and when it is associated also with retrognathia. When anesthetizing them, you always have the option of inhalational versus IV, but usually it's mostly described as IV, as inhalational in most of the books. So you give a gaseous induction with 100% oxygen and sevoflurane. And once the baby is relaxed enough, you can intubate him. Usually the intubation is difficult when you're having a palate formation because of the positioning of the laryngoscope. In case you're having this difficulty, you can always pack the cleft with some gauze to be able to stabilize the laryngoscope while manipulating it. And after preferably using a ray tube, because ray tubes are already bent, they are less likely to be obstructed or kinked by the gag used by the surgeon. A reinforced tube can also be used because it can resist compression. Preferably go with the intermittent positive pressure ventilation instead of keeping them spontaneously breathing. Encourage the infiltration of local anesthetic before the incision. You can always give them analgesia, fentanyl 2 to 4 mic, paracetamol IV, or diclofenac substitutes. Dexamethasone is always important at the dose of 0.1 milligram per kilogram because it prevents postoperative swelling. Consider an infraorbital nerve block for cleft lip repair and nasopalatine plus palatine block for palatal surgery. Always in those children, when it comes to extubating them, extubate awake, suction the pharynx, extubate with the baby in left lateral position. Nasal stent may be inserted to maintain patency of the airway in some cases, and in some cases, their tongue may need to be stitched. Ensure routine postoperative analgesia to include regular paracetamol, ibuprofen. Any questions so far?